Now let's talk about episiotomy. Episiotomy is a procedure that occurs when a care provider takes a pair of sterile scissors and they cut a small incision at the base of the vagina in the tissue between the vagina and the rectum, known as the perineum. In the 1900s, episiotomy became very, very popular, and in 1979, 80% of all people giving birth received an episiotomy. This is because many care providers believed that episiotomy was creating a straight cut that would be better than a natural tear. So they were basically cutting people to prevent them from tearing because they thought they would heal better from episiotomy. This is a very interesting approach to take, because no one seemed to want to take any steps to avoid tearing in the first place. We're just going to cut everyone instead. The rates of episiotomy, thankfully, have significantly declined because care providers started to learn that episiotomy really increases the risk of pelvic floor dysfunction. It's painful and it's way harder to heal from most of the time than a natural tear. So if someone's going to tear, it's better for them to have a natural tear than an episiotomy. And the best way to support people in birth is to take steps to prevent tearing in the first place. If you have any concerns about episiotomy, I recommend talking to your care provider and asking them what their episiotomy rate is and what circumstances would warrant an episiotomy in their mind. If you have any concerns about episiotomy, I recommend talking to your care provider and asking them what their episiotomy rate is and what circumstances would warrant an episiotomy in their mind. Evidence-based birth says that the episiotomy rate for each care provider should be below 1%. The national average for episiotomy is around 15% right now, and that really varies community to community. Some care providers really like to perform episiotomy still, while others will go an entire 20, 30, 40-year career and only perform an episiotomy a handful of times. Let's talk about the risks. There is an increased risk for perineal pain postpartum. There is an increased risk for infection in comparison to an intact perineum. There is an increased risk for pelvic floor dysfunction. The procedure can be painful. The procedure is sometimes overused and unwanted. Care providers who don't practice informed consent may perform an episiotomy on someone, especially someone who has an epidural and they cannot feel or see what's going on without their knowledge or consent. This is a form of obstetric abuse. Let's talk about the benefits. Episiotomy has the potential to expedite delivery in a life-threatening situation. This can be life-saving to a newborn, and it can also allow someone to have a vaginal birth in comparison to having to be rushed off to a cesarean. Here are some evidence-based ways to avoid an episiotomy. Find a care provider with a low episiotomy rate and a birthing facility with a low episiotomy rate. Perform perineal massage on your own or with your partner at the end of pregnancy. More on that in the 5 steps to preventing tears module. Birth in an upright position. Find a hands-off provider.